There we go.
Hello, everyone. Thank you for joining us today. If you were here last week, you already know how this goes. If this is your first time, welcome. We are excited to have Dr. Kennard here with us, and we are going to be talking about chronic pain with medical marijuana. So for those who don't know Dr. Kennard, he is the president and the physician at Pause Pain and Wellness. And Dr. Kennard, I don't know if you want to share a brief, introduction about yourself for those who might be new here.
Sure. So I'm coming to you live from my home in Oxford, Mississippi, where I have resided for my whole medical career, 15 years practicing chronic pain management. And that is our selected topic today. So this should be an easy one for me. I should not have to phone a friend, but I'm not afraid to if I have to. So I've been treating chronic pain with about anything I can throw at it, including some high-level procedure-based options with nerve blocks and ablations, and even spinal cord stimulator and spinal pump implants. And despite all that training and all those options, there's far too many patients, like I mentioned the last time, that just simply don't respond and need yet another option. And so cannabis is not a new option for me in my mindset about it. It's been around a long time. And when the law passed in Mississippi a year ago or more, I embraced it. And I wanted to kind of lead the charge amongst at least chronic pain physicians like myself to make sure that we don't restrict this as an option for reasons that aren't backed by good, sound evidence and science.
Mm-hmm. Awesome. Well, this is definitely going to be a very informative question Q&A today. And I know we've had a lot of really great questions already come through. For those who've already submitted, thank you so much. And for you that don't know how this goes, you can always put your questions in the comments below at any time, and we will be answering them. So the first one, I think this is a really good basis is, what is chronic pain and how does that affect an individual's life? I know from time to time, we all do experience pain in some regards, but when you put the word chronic in front of it, I think that gives it a whole new definition.
Yes, it does. And that's a very good intro to a mindset and distinguishing why we have painful responses to stimuli. So, acute pain obviously means now. You break your arm, you skin your knee, you get an IV started in your hand. You feel that as a protective mechanism as a living being so that you get away from whatever it was that was causing you pain so there's no more, and you decrease your chance of an injury. But beyond 3 to 6 months, if you're experiencing pain from an injury or just something that just came about, like osteoarthritis, migraines, that's the thing. The word chronic pain encompasses anything that causes extended pain. So it's really not in a box. It is a diagnosis in and of itself, but it's a very broad one. And so when patients that aren't even aware of the conditions that are necessary to obtain a card, there are 25 that are listed. One of them is chronic pain. In our experience, we've probably treated more of that than the other 24 conditions combined. So chronic pain is, there's hundreds of millions of people in the world that live with it. And the consequences of unmanaged chronic pain can be as devastating as the pain itself to the individual. So it can lead to depression, anxiety, lots of stress, lots of sleepless nights. And so with that basis, if you look at the potential benefits of cannabis, you see a single agent that's able to address 2, 3, and sometimes even 4 of the things that follow with chronic pain. And that's what makes it special.
Now, is there any timeline that is attached to chronic pain? Does somebody have to be experiencing pain for so long before it can be identified as chronic?
Yeah, technically, but 3 to 6 months or more, it starts to put you in a classification that it's chronic.
Mm.
So, you know,
Now,
if you've had a ACL repair or a major surgery and you were told that it would be a 6-month recovery, we're not really talking about how long it takes you to recover from an injury. It's the fact that you're experiencing more pain than you should beyond 3 to 6 months.
mm,
And like
that's
I said, the most important thing for prospective patients for this treatment to understand is chronic pain is a very generic, general heading that includes everything from lupus to chronic abdominal pelvic pain, even if nobody's found the cause. Okay. Chronic pain is chronic pain because you said it was chronic, the patient. It's not something we can do a blood test for or an x-ray. Unfortunately, it is your word that you hurt this way with this quality and it's affecting you, you know, in different ways and causing suffering. So when it comes to treatment, and I know this, we're going to lead into this question, that using medical cannabis for the treatment of chronic pain is special. And it's kind of why I embraced the law so fast and so comprehensively, because I know its potential and I can relate that to my colleagues and hopefully anybody else that will listen. The people that joined today are interested, hopefully, in knowing how it can help with chronic pain. And I'll explain that in detail. But the bottom line is if you have pain, headache, eye pain, tooth, dental pain, foot pain, from arthritis, from myofascial pain, fibromyalgia, if you have Crohn's disease, if you have chronic abdominal pain, all of it is chronic if it's lasted more than 3 to 6 months, and it shouldn't have.
Mm. And how does medical marijuana provide that relief for that chronic pain?
So that is obviously important because a lot of the classifications of pain under chronic pain have different qualities. So there's arthritic type pain that's inflammatory. There's what I like to refer with my patients to as kind of nervy pain. I ask them, does it feel like it's a nerve? Because you know your own body and your body's response, and you're the one that's lived with it. And you know what that means, that nervy kind of pounding, throbbing pain versus just muscle soreness from overexertion the few days before. People know how to classify it. But depending on whether you had inflammatory or a nervy type pain or abdominal pain or headaches, you would want to be knowledgeable about where to start if you were inexperienced and didn't already know with what form and strain and dose to start with. And that's the kind of knowledge base that our clinics and our practitioners have for you to help guide you.
Absolutely. And that, brings to a really great point is, how is medical marijuana interacting with the body? And from a biological standpoint, how does it all work and is relieving the chronic pain? And is it something that can essentially, go dissipate on its own, this pain, with prolonged use of medical marijuana? Or is that medical marijuana something you have to continuously take to alleviate the pain?
Great question. Was that one from a patient?
Yes.
Yeah, I thought so. Because that sounds like something a patient would be very interested in. Is this a lifelong treatment like a lot of the other ones, like opioids?
Mm-hmm.
Let's just take mood depression as an example. Mood depression, not to get too far in the weeds on mechanism, but if you lack serotonin naturally the way you were born, you may be more susceptible to having a depressed mood because serotonin balances your mood. When you take a medication like an antidepressant, it allows for an increased level of serotonin just to bring you balance. You don't necessarily need more than the next person. You just need the same amount they have, the non-depressed person. Typically, you don't come off of that later. If you've had chronic depression for several years, even if it's not related to an incident, an environmental stimulus, you just have it. Your mood is depressed, and a lot of people go way too long before this is assessed and treated. But when you take an antidepressant and restores that chemical level, it's mostly unlikely that you just taper off of it once you start feeling better, and the level's going to drop. So same with cannabis treatment or a lot of treatments for diseases. It is important to know that to date, we don't have the clear evidence that cannabis cures any disease. We do not have that. There's some exciting research going on about some treatments in some tumors and cancer suppressing their growth and things like this. But so the pointed answer to the question is, what we see and what the literature has shown is that it's a treatment that if your chronic pain has persisted for more than 3 to 6 months, and it's likely that it would if you didn't do anything about it indefinitely, this treatment should be looked at as a ongoing treatment. With that said, most people stabilize on a dose for pain and for medical treatments, unlike recreational use, which is another question that we can dive into. The goals of those two things are different. So once you achieve pain relief with cannabis, you typically stabilize out and level and don't have to increase your dose much going forward that we've seen. You can develop a little tolerance, but a lot of that tolerance is to the way it makes you feel. It's not, the pain relief is there. You get tolerance to the way it makes you feel. So it's still achieving the pain relief without making you swimmy headed and dizzy and some of the things that it can do even when you take it correctly at the beginning. A lot of those subside, but the pain relief remains at a much lower dose than a lot of people would like to believe, and certainly much lower than what recreational users need to get the effect that they want. That's a long answer. We get ready for the long answers.
I love it. Well, that's great because it segues into the next question. And the next question that somebody has submitted was, will they have to eventually change the type of medical marijuana that they're taking? So if they start out with a tincture, are they going to have to switch to an edible or a gummy, or are they going to have to increase their dosage over time because their body is, say, getting used to a certain type of medical marijuana that they're using?
Yes, perfect. So it takes that same concept just to the next level of treatment. So you've registered, you feel good about it, everybody's all in, I have my card, I've gone to the dispensary, I've gotten a starting dose that I'm comfortable with. Now what do I expect? So the expectation should be that first you have to start with step one, which is achieving stability. And how you do that, the difference in doing that correctly and having it really go not so good for you has to be done very carefully. If you take too much or the wrong thing right off the bat, you may get frustrated and kind of lose confidence. Mm-hmm. So what we really focus on is your experience level with this. If you're very experienced coming in and you already kind of know what you want and what's worked for you from past use, there may not be a whole lot that you need going forward from us. But I bet you, if you read our literature and come in for your evaluation, everybody is willing to learn. And I'd be surprised that even the experienced patients can benefit from knowing some of the tricks of the trade, so to speak. So, but the inexperienced need lots of guidance. And so we would help guide you with strain, formulation, and dose right off the bat so that you start comfortably and you kind of energize those receptors that it's going to be acting on in a slow and controlled way. Then we follow up and see where you reach stability. Most of the time, the first form you choose could be all you need. But we expect that you may need to kind of graduate after 2, 3, 4 weeks to another form. Once your total dose is determined, we can convert you to maybe a more user-friendly form. For instance, if we start out with a dropper under the tongue, you may not want to carry around that dropper if you need it every 4 hours to be stable, because the droppers, they act pretty quickly, but they maybe not last as long. You may want to graduate then to an edible twice a day that you can take it home, leave, and not have to carry with you. So there's lots of different dosing strategies. Whether or not you need to change to a different form is only determined by your individual case, but you have lots of options for that if you need it.
I love that. It's really very informative. And it sounds like, there's a very methodical process, especially for those people who are newly coming into this and exploring this as a first-time option. So it sounds like they're in some really great care. Another question that came in is the combination with other pain management therapies. So do they interact? Do they amplify each other? What can we recommend for people who are already on some sort of pain management regimen?
Yes. So, that is, in my practice, I had patients that were already using CBDs and even the real stuff and getting it from other states. And just, we live in a practical world here. They're at risk. They were at risk, and you still are. If you're receiving a product from out of state, transferring that across state lines is technically federally illegal. And I think most people are aware of that. To date, there hasn't been a really aggressive search and destroy mission by the government to find these people or regulate this. So people have become more and more comfortable finding it from other sources and taking it, because until a year ago, they didn't have an option here. Well, now that you have a legal option, I encourage you to explore that and let the law be on your side now. And Mississippi will have equally exceptional quality products and formulations as any other state. We may be a little bit more restrictive on the front end because we don't want it to go to have a program that's not respectful. But I can tell you, with my knowledge of who's growing and who's dispensing and the professionals in that side of things, they are serious about it, and it's going to be great quality. So for pain patients, now in my pain practice, we're just encouraging them, if you're going to continue using this, just get your card, do it legally. We have no issue with it. But so I like to break chronic pain patients down into those two categories. So is it inflammatory or is it nerve pain? Because you really need to know that first. And then on the top of that is your experience level with it at all. If there's no experience, you can choose inflammatory or nervy, but a lot of people have an intermixing of those two. That's going to help us start you off on a basic formulation to get started with. Then there's another category of patients, though, on opioids. And so that is a hot topic, and clearly one of the goals for cannabis for me, personally and globally amongst the pain community, is, can we reduce the amount of opioids somebody requires? Even, someone taking it legitimately, coming for their appointments, they're super compliant, but I've just seen too many of them. They're super compliant, their own opioids, they do help, but it's just not enough. And so all opioids do also is treat the pain. They do not help with muscle spasm. They do not help with sleep. They do not help with depressed mood or anxiety, and sometimes can make all of those worse and cause constipation. So cannabis helps with all of those and does not cause that. And so it is a great option, but has to be done very carefully. Those opioid patients need to be under the care of a staff that knows how to transition them safely, because they're hearing a lot of different things, because I'm hearing them. Some of them are pretty frustrating to me as a clinician that has a lot of perspective about cannabis and knows the research, what some of the patients are telling us they're hearing from their other clinicians about taking cannabis and taking opioids at the same time.
Yeah, absolutely. And I think you nailed the right on the head. It transitions safely away. So make sure if
Yeah.
this is you, you are working with one of the physicians and you're doing it in a way where somebody's guiding you in a step-by-step process so it can be as safe as possible for you. Leading into the next question, and it's, are there any drug interactions? So say somebody is on, basically chronic pharmaceuticals, whether it be warfarin or other life supporting, pharmaceuticals. Is there any interaction? And can these patients still safely take medical marijuana with their already pharmaceutical regimen?
Yes, there are interactions, and those interactions are something that in medical school and in training we have to be super sensitive to, because you can select everything out just right, but if the drug doesn't mix with what they're already taking, it's a barrier, and it could potentially be dangerous. So for cannabis, the list is much shorter than a lot of drugs, including aspirin and some of the more common drugs that people are already taking, like I mentioned before, antidepressants, anticoagulant drugs, antibiotics. If you pull up the list of drug interactions, it's just exhausting. You just get very overwhelmed and intimidated by seeing that. With cannabis, there are some. The main takeaway point of mixing cannabis with what you're already on is that it is sedative and can be sedative. There's certain strains that are more or less sedative, but all of them to some degree are going to cause a little sedation. I think everybody mentally perceives that as probably the number one side effect, that it makes me a little tired. So if you're taking other drugs that are sedative, it could be an antihistamine, but it could also be a benzodiazepine, something for anxiety, or an opioid, or a muscle relaxant or something like that, which are common for pain patients. Then how you incorporate and start your cannabis treatment needs to be low and slow and take all that into consideration, so you're not too sleepy as you get started, because some patients are older and can be fall risk anyway. Making them sedated is not recommended, but how you approach that carefully is matter. So the biggest interaction is that it could be sedative with other sedative medications. There are some, like you mentioned, warfarin, the Coumadin, the blood thinning medication, that it has shown some interaction with. It typically makes the warfarin make your blood more thin, not less. So if you were going to choose an interaction that was better than the other, you'd want the blood to be thinner than it stop the action of the warfarin. So our website has some pretty good information on specific drug interactions, and it's one of the things that we'll look at in your evaluation. We're going to have your medication list, and we're going to run it across the spectrum of interactions to make sure we can give you the heads up if you need to be paying attention to something that you're already on.
Beautiful. I have the website linked below if you want to go and check out that list. It's pausethepain.com. And we do have about 5 more minutes for any last questions. So if you want to go ahead and ask them now. And we do have one coming in from Facebook. And it says, do you feel that concentration limits will be extended eventually? And if so, is there anything in the works towards that end? Will things likely Disalate ever be available for patients in Mississippi?
Yeah, so I do think there will be an increase in the limits. That's without any real concrete knowledge or conversations. It's just Mississippians should be proud that Mississippi passed this law, just to begin with. That we're here a little over a year after it was passed, and we got dispensaries open with product is an amazing feat for a pretty conservative state. With that being said, I think the 3.5 ounce limit per month potentially could be increased. The concentration of THC in flower is limited to 30%. That's still pretty high. If you compare that to your grandpa's marijuana, it was maybe 5%. So 30% is for medical patients is sufficient. I will tell you that. Now, let's take the topic of recreational. If it goes recreational in the future, most of the states that started medical and then transitioned to what they call dual purpose, which is recreational and medical, they keep a pretty healthy medical program for a couple of reasons. Most of those states increase the limit in the concentrations for medical patients over that for recreational patients. So you can get more and more concentrated because you're taking it for a medical indication, whereas the recreational users after it for something that's just more casual, right? So if we do change it, or we go to a recreational status as well, hopefully we'll keep a medical program, and that will bear out in Mississippi as well. So distillate is a potential in Mississippi now. So distillate is limited to 60%. All right, so distillate is something that I do not recommend to inexperienced patients because it is so concentrated. But it's what you can take. It's like the serum. It's got the pure, it's almost pure THC. And it's very potent and needs to be used with caution, but you can take that distillate at that super concentration and you can make your own edibles and things like that. That's what a lot of people do with it. I believe that is possible. I know that the oils and things like that are being made, oils and tinctures for sure. But 60% is the cutoff for the distillate or the concentrate. I hope that answers that question. But I think that we should be proud that we've got a good starting point. And for most of the medical patients we're seeing now, the dosing limits and the quantities, at least for now to get started, are plenty.
Thank you, Dr. Kennard. That was very informative. I feel like you did answer that question fully. And I agree, we should be proud that Mississippi now has these laws, and the future is so bright. And I'm sure that you could go on with what that future looks like for pain relief for these patients.
Yes.
And this was a wonderful Q&A session, and that's all the time that we have today. But if you have any more questions, feel free to put them in the group. We're seeing some great interaction, and introduce yourself as well too. And we'll get those questions answered, and Dr. Kennard will be available too. So if you've missed this or you're seeing the replay, go ahead and put your questions in the group and we'll make sure to get them answered. And tune in next week, same time, and we'll be covering more topics about medical marijuana. So thank you so much for joining us today.
Thanks, everyone. Thanks, Brittany.
Thanks.